Hello, it's another edition of TessTalk. I'm Dr. Tess Garcia of Garcia Family Medicine. I think it was last month I talked some about how heart attacks present differently or can present differently in women than they do in men. Today I'm going to talk about a bunch of different ways your heart can kill you, because heart attacks will kill you. Okay, so let's start out with coronary artery disease, which somewhere during my medical career they decided to change to coronary heart disease. Coronary artery disease basically happens because the coronary arteries, which are the arteries around the heart, we're not talking about the aorta, which comes off the heart, or the pulmonary artery, which comes out the heart. We're talking about all these different arteries covering different territories of the heart. When they get clogged, they get narrowed because there's plaque, which basically comes from cholesterol, but also it just kind of happens to come with aging. And this cuts down on the amount of blood that can get to the various areas of the heart, depending on which one is blocked. Now, two things that are related to coronary artery disease. Angina, which is chest pain, kind of central, radiates to your jaw, can radiate to your left arm, sometimes can radiate to your right arm, but usually if it does, it's doing the left arm and right arm. It can happen because of physical activity. It can happen because of stress. It can happen because of cold weather. Angina implies that it's a chronic problem that you have to deal with, uncomfortable, could go on to a heart attack, but typically they're partially blocked and blood's still getting through. But when blood doesn't go to a particular territory of the heart, the muscle starts reacting about it, and the reaction is usually perceived as pain. Let's go on to heart attacks or myocardial infarction. Infarction is a fancy name which means something's blocked somewhere. How it looks on an EKG when somebody has a heart attack is different based on which artery tends to be involved. But now the big thing, you're having a heart attack, particularly if it is what we call a STEMI or ST segment elevation myocardial infarction. They'll zip you into the cardiac cath lab and clear out the blockage, and they inject dye into your heart. Oh, and it used to be they always did it through the thigh, the femoral artery down here. Now they can do it through your wrist. Okay, so heart attack, angina, coronary artery disease, basically all of them because there's narrowing and blockage in the coronary arteries. Heart attacks, as you know, can kill you. Angina typically doesn't kill you, but people who have regular angina and they know why they have it, it's called stable angina. But then we have unstable angina. That one, you have to get them in the hospital and decide whether you're doing a cardiac cath or if you're going to do a chemical stress electrocardiogram. You got to do something to figure out what's going on there, what is making this unstable angina happen. The next one that happens is congestive heart failure. This is when the heart can't pump right, and it's caused by a number of different things. But typically, blood is getting blocked to a particular coronary artery. The muscle of the heart supplied by that artery gets damaged and can actually start dying and becoming necrotic. When that happens, a person is going to end up with congestive heart failure after the fact. Because that part of the muscle's dying, it's not contracting properly. And we can determine that on an echocardiogram. So heart attacks is one way you can end up having damaged heart wall. If your blood pressure is too high and untreated, the heart is having to pump against the pressure in the arteries. And as it's pushing against it, the arteries are clenched up because you have high blood pressure. That's what happens in high blood pressure. It makes your arteries clench up so that the pressure gets higher to try and get the blood through to supply the body. In that situation, the heart muscle of the left ventricle, the ventricles are the bottom half of the heart, and the auricles or atria are on the upper part of that heart. The ventricles are the ones that do the major pumping either into the lungs or into your body. What happens, the left ventricle muscle starts building up. When you are using a muscle, it develops hypertrophy. That's what you're doing when you're going and working with weights. Well, hypertrophy in the heart is not a good thing. The heart gets enlarged and it can't pump as well. It can only squeeze out, say, 30%, 40%. Ejection fraction is the fraction of the blood that's in the ventricle that's getting shot to the heart or the lungs. When you have left ventricular hypertrophy, less blood gets in and less blood gets out. Congestive heart failure basically can kill you too, but it's one that requires a lot of medications to manage to keep you going. But now with the different kind of medications that we have, you are able to stay alive with heart failure and not be as uncomfortable as you are when your legs are all swollen up all the time and you're having shortness of breath because the heart is backing up into the lungs. Since the heart can't pump all the blood out, it backs up into the pulmonary artery and the lungs start developing fluid in them. So you can be very uncomfortable if you have untreated congestive heart failure. Next type of heart diseases that can create a problem are the valvular heart diseases. There are 4 major valves inside the heart. Valves can become damaged. They can become stenotic, meaning they're closed and tight so less blood can go through. There's regurgitation, or insufficiency, meaning the valve doesn't close completely and blood regurgitates back into the previous chamber. And then there's prolapse, where the valve itself flops back into the previous chamber. There, the problem is it creates flow issues when you have a prolapse. When you get either an insufficiency or a prolapse, then you have the turbulence, which can create clots, and those little clots can break off and go and give you strokes. Okay, stenosis tend to happen more in the valves that's sending blood out of the heart. Aortic stenosis is one that probably all of us as we get older have a certain amount of. Now we can tell exactly which valves are having trouble, and we can tell if it's an insufficiency or a prolapse or a stenosis. Next problem is arrhythmias. Arrhythmia, normally the heart is lub-dub, lub-dub, lub-dub. It just does its thing. Arrhythmias is when it stops beating in rhythm. And there are a lot of different kinds of arrhythmias. Main one everybody knows about is AFib, or atrial fibrillation. And basically, it's the top half of the heart talking to the bottom half of the heart, but instead of sending a regular signal that would then make the ventricles fire and beat, the atrium isn't beating anymore. And the heart just starts quivering and it's sending off signals, but they're not going regularly. And so the heartbeat is what we call irregularly irregular. So with atrial fibrillation, just like with the valve problem, since it's not beating regularly, you're getting turbulence, you're getting places where the blood slows down because it's not going and leaving the atrium, and you can develop clots. So atrial fibrillation, you've got to have anticoagulation. Okay, so after atrial fibrillation, there's something called a flutter, and that's when the atrium is sending out real fast signals. And the bottom half of the heart only responds, say, to some of those signals coming through. A flutter is not irregularly irregular. It's usually regularly irregular. Then there's the famous VTAC, ventricular tachycardia. When the heartbeat is not being driven from the sinoatrial node in the atrium, it's actually being generated in the ventricles. And when it's tachycardic, you can have a premature ventricular contraction where it just pops in early, but VTAC, it's boom, 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 going really fast, and the major problem with it is that it can deteriorate into ventricular fibrillation or VFib. Typically with VFib, you pass out. Those ones can go into straight asystole, where the heart is not beating. And those are the ones where you're supposed to get on them and start doing chest compressions. The fastest you can get someone defibrillated is what tells whether you're going to survive or not. So that's VFib. VTAC usually tends to deteriorate into VFib. So those are the main types of arrhythmias. Then there's the congenital heart diseases, which means the baby is born with a heart defect. And then there are inherited heart conditions. Inherited heart diseases are the ones where there's something in your family that makes you tend to have this problem. There's other cardiomyopathies, and cardiomyopathy is when the muscles aren't beating right. With any cardiomyopathy, you're going to have congestive heart failure because the heart isn't beating right. So some people ask, which one of these conditions is the most severe, the one most likely to kill you? And as I started out saying, all of these are ways that your heart can kill you. The question is how severe that condition is. So I can't say that heart attacks are going to kill you more than congestive heart failure and a valve problem. No, it's how severe you present within that particular condition. So those are the different ways that your heart can kill you.